Three things that are super important to think about in a pediatric consultation role play that you might be doing in a medical exam, such as RCA, CSA, PLAB2, or many other OSCE type assessments where you're dealing with a pediatric scenario. We're going to talk about birth history, immunization history, and growth and development. I'm Dr. Arora. I'm a GP in full-time medical education at Arora Medical Education, and we help doctors pass their medical exams and progress in their careers. Let's talk about birth history first now, but actually before we get to all of this, in a pediatric case, of course, you're going to be doing lots and lots of data gathering and lots of history, trying to work out diagnoses, trying to understand presenting complaints, history of presenting complaints, the symptoms that are coming with, the social history, all that kind of thing is really important. But these three things can show and demonstrate that you're thinking about a global picture. You're trying to take into account a generalized pediatric background to try and put all the current things into context. Let's start with birth history. Mr. and Mrs. X, I just want to go back a little bit and ask a couple of questions about your child's birth, because sometimes things that happen there can really influence things that happen later on in their childhood. So ask about how the birth was, any complications, was it all on time, were there any issues that you haven't perhaps got on your notes in front of you that might be important for you to know as a clinician. Secondly, immunization. Mr. and Mrs. X, can I just go back and ask a little bit about your child's immunizations? Are they up to date? Have there been any missed out? Any things that we need to know that, again, might influence things that we're doing today for the presentation that that child might have come in for? And thirdly, growth and development. Mr. and Mrs. X, have there been any concerns raised or anyone mentioned anything about your child's growth and development, anything picked up by school, health visitors, or anyone else involved that has been mentioned that we're not aware of? Again, asking this shows that you may be putting things into context based on previous history of that child. Now, of course, it's important, like I said, to do a detailed history about what has come in there and then about that particular child. But when you demonstrate understanding of birth history, immunization history, and growth and development, you're showing that overall assessment, and you're demonstrating how these kind of things that are often overlooked can have a huge impact on how you assess that situation right now. Now, there may be nothing that comes out of these three things. It may be simple, no, doctor, everything is fine. But there may be things that come out that actually change how that role play goes. Now, we do much more teaching on pediatric scenarios on our live courses, our online courses, and our audiobook courses, whether it's for CSA, RCA, PLAB2, and many others. If you want 10% off any of those courses, then head to the website aroramedicaleducation.co.uk and use the code AroraVideo10, ARORAVIDEO10, and you can get 10% off any of the online, audio, or live courses that we run, where we do and practice and teach on more pediatric and many other types of scenario that you might face in your exam or your assessment. Hope this helps. You know the hashtag, can pass will pass, hashtag I went with Arora. Have a good day.